In mice, a male contraceptive pill was shown to be 99% effective. A group of scientists announced on Wednesday that they had discovered a male oral contraceptive that was 99% successful in mice and had no discernible side effects, with human trials due by the end of the year. The discoveries will be presented at the American Chemical Society's spring meeting, and they represent a significant step forward in men's birth control options and responsibilities. MD Abdullah Al-Noman, a PhD student at the University of Minnesota who will present the findings, told AFP that researchers have been interested in a male version since the female birth control pill was originally allowed in the 1960s. Many studies have shown that men want to share the responsibility of birth control with their partners, he said, but there have only been two effective methods accessible up until now: condoms or vasectomies. Vasectomy reversal surgery is costly and does not always work. The female pill employs hormones to disrupt the menstrual cycle, and previous attempts to create a male equivalent focused on testosterone, the male sex hormone. COVID-19 vaccine could become a yearly shot. According to experts, the problem with this method was that it resulted in weight gain, depression, and higher levels of a cholesterol called low-density lipoprotein, which raises the risk of heart disease. The female pill has adverse effects as well, including the risk of blood clotting. But because women are more likely to become pregnant without contraception, the risk assessment is different. Noman, who works in Professor Gunda Georg's lab, focused on a protein called retinoic acid receptor (RAR-alpha) to produce a non-hormonal medication. Vitamin A is converted to several forms in the body, including retinoic acid, which is involved in cell proliferation, sperm production, and embryo development. To achieve these tasks, retinoic acid must interact with RAR-alpha, and mice lacking the RAR-alpha gene are sterile in experimental studies. Noman and Georg created a chemical that inhibits RAR function alphas as part of their research. With the use of a computer model, they found the optimal chemical structure. We can build a better key if we know what the keyhole looks like, Noman explained. In order to reduce potential adverse effects, their molecule, known as YCT529, was engineered to interact just with RAR-alpha and not with two other related receptors, RAR-beta and RAR-gamma. In a mating study, YCT529 was 99% effective in reducing sperm counts and preventing conception when given orally to male mice for 4 weeks. The researchers kept track of the mice's weight, hunger, and overall activity and found no negative effects, despite the fact that mice can't report side effects like headaches or mood swings. The mice may sire pups again 4 to 6 weeks after they were taken off the medicine. The team is collaborating with a startup named Your Choice Therapeutics to begin human trials by the third or fourth quarter of 2022, according to Georg, who got funding from the National Institutes of Health and the Male Contraceptive Initiative. "I'm optimistic this will move along rapidly," she said, predicting a 5-year or less timeline to market. "There's no assurance that it would work. But I'd be shocked if we didn't see a human effect as well," she added. The question of whether women will trust males to utilize future male contraceptive tablets has lingered. However, surveys have revealed that most women have faith in their relationships, and that a considerable proportion of men are willing to try the medication. Male contraceptives will add to the technique mix, providing additional options that allow men and women to participate in whatever way they deem suitable to contraceptive use, asserts the Male Contraceptive Initiative, a nonprofit that raises funds and advocates for the use of male contraceptives.